This is News 4, watching out for you.
New projections for the St. Louis region show some of the area's precautions against the coronavirus appear to be working. Good afternoon, everyone. Thank you for joining us. I'm Claire Kellett. In just the last 30 minutes, the head of the St. Louis Metropolitan Pandemic Task Force said we expect to hit our peak in hospitalizations in just 10 days. News 4's Kim St. Ange joins us live this afternoon with Dr. Alex Garza, the head of the St. Louis Metropolitan Pandemic Task Force.
Right, Claire. So Dr. Garza is saying that he expects the peak in the St. Louis area to be April 25th, so just 10 days away from now. At that point, expecting roughly 71,000 people to be infected with coronavirus. Now, that really is good news because they initially were predicting possibly 80,000. He attributes that really to us putting these measures in place like social distancing, the stay-at-home order, all these things that we're doing to try to slow down the spread of COVID-19. Dr. Garza joins me live right now. So we were just talking about these new projections. So with that in mind, when would you recommend government officials should maybe relax some of these measures?
Yeah, that's a great question. It's one I get asked often. I don't think so. It's not a question of really let's pick a date. I don't think we can even begin to talk about relaxing till at least the middle of May, to be honest. And then a series of things have to happen by then. So it's really having a strategy so that when we do decide what a good date is, that we ensure success after we start relaxing. So, we're going to have to understand what parts of the economy do we want to open first, and then what sorts of things do we have in place so that we can ensure that there is no further dramatic spread in the community. And so it's bigger than just a date. It's a whole strategy that has to revolve around a date.
Are you at all worried there could be a second peak after April 25th?
Yeah, we're always worried. Yeah, no, absolutely. People ask me, what's the biggest thing you worry about now? And that is sort of my biggest worry right now. We've done a really good job on the first wave with all of the measures that we've put in place. And so I'm confident that, that our healthcare systems can handle that first wave. So what concerns me now is we shouldn't be lulled into that false sense of security that everything is going to be fine on the back. And we have to be very deliberate and think very hard about how we're going to manage this on the back end.
Dr. Garza, thank you so much. We're going to have more for you tonight on News 4 at 5 o'clock. For now, live in Creve Coeur, Kim St. Ange, News 4.
This afternoon, St. Louis Mayor Lida